Good evening. Thank you all so much for being here. My name is Andrea Rich, and I'm the managing editor of the Lebanon Daily News. And we call this community forum to bring all of us together. Lebanon County clearly, and we're not alone in this in America, but Lebanon County clearly has a heroin problem. And there's no one person that can solve this problem. And so we wanted to bring all of us together and try to come up with some sort of conversation so that we do not become complacent about what is happening in our community. We are here to work together as a community to tackle this problem, this drug, which is so unsafe, so unhealthy, and also so illegal. At this time, I would like to have the four gentlemen here on the panel that represent portions of our community that do deal with this problem every day, and also have the responsibility of handling the legal and the health aspects of this problem. After their introductions, we're going to go ahead and open it right up to community conversation. If there is something that you would like to say, please raise your hand, and Danielle will come to you with the microphone. We'll start with our District Attorney, Dave Arnold.
Thank you, Andrew. First, I do want to thank you, Andrew, and the Daily News for hosting this event, along with Gary. I'd like to thank you, Andrew, as well as the Daily News and HAC for hosting the event, my colleagues up here, and of course everybody for attending tonight. My name is Dave Arnold, I'm the District Attorney of Lebanon County, so I've got a little bit different perspective to some extent than perhaps the other people on the panel, but certainly my number one concern and concern for being here is safety. It's public safety, it's safety for people who already have an addiction, it's safety for people who don't use heroin, and hopefully we can keep them from doing so, and of course safety for the community from the drug users and the drug dealers. So I'm certainly interested in discussing the topic tonight, and hopefully we can work together to find some answers for the problems that we're having.
Hello everyone, I'm Marc Bonin. I'm Emergency Room Medical Director and Chairman at Good Sam. And thanks for inviting me tonight. I did my training locally in New York, Pennsylvania, and I've been in emergency medicine now 19 years. So I have seen a lot of the health problems associated with drug use, drug abuse, and some of the secondary problems as well. And I'm here to help out in any way I can.
Good evening. My name is Bryan Smith. I'm the Executive Director and Chief of Operations with First Aid and Safety Patrol EMS. We're the EMS provider here in Lebanon City and the majority of Lebanon County, and provide the paramedic services to the eastern end of Lebanon County as well. I've been with the organization for this November will be 20 years, and I've certainly seen a large number of changes. I've been in this role as a director for 8 years, and certainly seen the increase in many of the overdoses, not just heroin, but the plethora of illegal drugs that are on our streets. And I certainly commend everybody for coming together tonight and having a community discussion, because it's certainly needed at this time. And we want to play a role, not just as an emergency provider, but also on the prevention side. So thank you.
Good evening. My name is Jim Donmoyer. I'm the Executive Director of Lebanon County Commission on Drug and Alcohol Abuse. I want to start off by thanking Andrea for having this event. I also want to thank everybody that's in attendance. The turnout is tremendous. This is what we need in our community. The reason I'm part of this panel, my office provides funding for people in the community of Lebanon who cannot afford treatment. We fund people to go to treatment. We have a wide range of services. I'm here to pretty much make people aware of some things that are going on in this community at the present time. One of the things we should be aware of as a group, this is an epidemic not only here, but it's statewide. Just this morning I got a phone call from Dr. Yoakum Every time he calls me, it's not good news. To date, we have 15 overdose deaths in Lebanon County. Last year, we had 18, so it looks like the numbers are increasing here in our county. The other thing that our office has seen over the last 2 or 3 years, Lebanon County used to be a county where alcohol was the predominant drug of choice. That is no longer the case. The past 3 years, it's been heroin, and it's been increasingly getting worse. So I'm here tonight for awareness, education, information, answer any questions you may have. I have a gentleman with me, Mr. Count. He's sitting over there at the table. He has literature from our office. He also will answer any questions you may have. So if I'm not available tonight at some point in time, Mr. Count is over there. He will help talk to whoever needs to talk. Thank you.
Okay, at this time, if there's anybody that has anything that they'd like to say, any questions that they'd like to ask, if you want to raise your hand.
Thank you very much for
My name is Denise. My son is a heroin addict. And there's just, I could probably stand here going all night, but obviously there's a lot of people that would speak. I think one of the main things that I noticed, and I think is very, very important, is the need to educate parents at high school level. Because when this happened, my son was 26, I don't think we were aware of the signs of the severity of it, and this did start way back then. So I think it's very, very important to get the word out to high schools. And, you know, I have loads of friends and acquaintances through Narnon and other programs that would be more than willing to do that. So, you know, mine is to get the word out. And I don't know if any of you are familiar with what they're doing in Gloucester, Massachusetts, with the police initiative. And I do have correspondence here that I'm going to be handing out to police departments. But they have a program and where they are training police officers to go out, and when someone is overdosed, they are given the option at that time to go to treatment rather than putting them in jail, which is what happened with my son. And he struggles every day. And I think all of us involved in this realize this is a disease. It is not something that is fixed by sticking a child in jail for 12 months, surrounded by others that are doing the same thing. You know, because that's all they talk about, that's all they hear. They need to be in treatment, they need to be helped. And I know I speak for a vast majority of people. But, you know, they're trying to help, they're trying to educate communities, and I just, you know, felt the need to discuss that, and I will pass this information out to you. And one of the main things I think is my son did probably 4 or 5 rehabs, and then went to recovery homes. And I think they need more regulations in these recovery houses. It's too easy for them to obtain drugs in the recovery homes and to relapse, and it goes right back into the system. So I think that's another thing, that if maybe we could have more regulations, that the people that were caring for their homes and in charge of the homes, they were more enforced as far as drug testing and so forth. And the last thing I want to mention is I think it's very necessary for parents and loved ones to have access to Narcan and to be able to have that on hand if their loved one is going to be visiting home, and to be able to save their life if something does happen. Right now it's very difficult to get it. Some of the doctors, if you go to, they will say, well, you know, your child isn't a patient, so we can't get it for you. So I'm hoping that that's something we can roll into. Thank you. Sure.
I want to thank you for sharing all that. It is very helpful. And whatever information you can provide to me, I'd be more than willing to take it. Just a couple things I'd like to touch on. A couple things you said. I just want to throw some plugs out, I guess. There is a support group here in Lebanon County that's been here for quite some time. And it's for people that are involved, family members have a heroin addiction. It's called Families Join. Okay? You're shaking your head like you're well aware of this. I'm glad to hear that. Other people in the audience, if you're in need of support, these people in this group are also going through what she just explained. PCS, they're here tonight as well as a provider. They're a local provider. I see that she has handouts for Families Join, so that would be one place where people can go to get support. Okay, that's the first thing I want to say. The other thing I wanted to talk about is you talk about parents being involved with the child, and I totally agree with that. And some of the things as far as treatment has always been, we're going to treat the person, which we know is not the entire problem. So in order to treat that person, a lot of the treatment modalities and things are turning towards treating the family as well. One example is we have a program here in Lebanon County. It's for adolescents. It's an outpatient program. It's called Contingency Management. Again, it's through PCS. And what that's about is the family has to be involved. They have to be with the child in therapy together. It's no longer kids over here and parents don't know what's going on while the kid's in that room. You guys are together. And other modalities, other treatment providers are going to that approach. One of the things that my office has done recently is we applied for a $5 million grant through the Department of Drug and Alcohol Programs. And what we're trying to do with that is bring a program to Lebanon County. We're not getting the whole $5 million. I hope we're getting some of that money. But our idea is to implement a family program to deal with this heroin issue. So we know it's not just the individual. We know the parents are part of the whole, I'd have to say, the problem as well as the solution. Thank you.
My name's Ed Price, and I'd like to ask the panel if they could perhaps give us an idea of how widespread this problem is as far as the number of arrests, the number of calls to the ambulances to pick up people with overdoses and how they're treated at the center.
I guess I'll start because we're at least the initial response pertains to the 911 response. I pulled data from April 1st of this year to the 15th of September, which we know is 2 days ago. We've already changed the numbers since then. We've administered 130 doses of Narcan since April 1st. On average, it's we're handling one overdose. When I say that we recognize Narcan has made an impact, it doesn't necessarily mean it's specifically heroin. It's any of the opiates. So we've been administering heroin or administering Narcan with a pace of about every other day. But it's when you look at the doses to the number of responses, it's actually about 1.5 doses until we're getting the results that we want to achieve. And those results have changed since I became a paramedic 19 years ago. We're no longer looking for immediate, complete awake because we want to control the response and control the recovery and get them to the hospital so we can start the process of reversing the effects of the heroin. If we carry 32 medications in our EMS units, and Narcan is the 5th highest administration of medications of those 32 throughout our pack. So we certainly can recognize in that period of time how frequently that medication is being administered. It's actually, at this point, it's actually higher than medications that we give for asthma and spread.
Good Sam, I'm at the receiving end, working with Bryan these cases. And prior to coming, I pulled numbers from May, June, and July as far as overall overdoses. In May, we treated 71 overdoses. In June, 56. In July, 74. Now, that's not just heroin, but that's all serious overdoses that require emergency department care. So that just, we have, on average, several.
As far as numbers go, our office, again, I said heroin has overtaken alcohol. 3 years ago, we dealt with 192 individuals that came in for heroin-related situations. Last year, it was, well, the year after that was 234. Last year was 245, and we expect it to be up over 300. And we serve about 600 people a year, so that's half our business.
Hi, my name is Carol, and I would like to encourage any family member who has a child, a husband, a wife, an uncle, or an aunt, run to your nearest support group for families. I was happy to hear about the family. Yes. I'm a grateful member of Al-Anon, and our focus is basically alcoholism. But let's face it, an addiction is an addiction, whether it be alcohol, heroin, whatever. And there is a lot of hope for the addict when the family members learn to stop enabling. And Al-Anon is a very good place for families to start learning to say, no, I'm not going to give you money for drugs. I'm not going to support your habit. It's a really good program, and we have meetings every night of the week. And don't let it confuse you, because there is a lot of focus on alcoholism, but we are seeing more members come in with their loved ones who are suffering from heroin. And it is a disease. It is not a choice to use. Thank you.
Hi, this is a question for the gentleman for State and Safety Patrol. It sounds like you're administering in our town a fairly regular basis. Do you have any policy and procedure in place to follow up treatment or information for those individuals?
Let me just make sure I understand. So we administer Narcan, we have something to provide back to the patient?
Yes. Because it's my understanding that Narcan is really like a one-time wonder. So that same individual that we've now revived, if they go back and use, the second time they won't be as lucky with the Narcan.
Yeah, absolutely. Well, the answer to that is no, we don't. We are primarily charged with the process of the administration, provide some life-saving care, care pre-hospitally, and transport to the closest facility in Lebanon here. It's Samaritan Hospital. Once that process is complete, we're going to the next call. So we kind of disengage at that point and move on. So we don't. However, as I said earlier, we want to be part of the prevention piece. And I heard a couple good things already that certainly sparked my interest that maybe we can get involved with.
My name's Diane, and my son Matthew is one of the statistics of this year for heroin deaths. He was 27 years old. And I read about the program in Massachusetts, and I agree that sounds like a wonderful starting point. But my goal here tonight is to hopefully that we can acknowledge that we need to address the issue from the root all the way through the recovery process. And my son didn't get arrested. He didn't have any criminal record for drug addiction, so the program like in Massachusetts, which is wonderful, that captures a heroin addict at a certain stage once they're at that point. But my son really needed help prior to that, and we didn't know where to go. And he actually overdosed about 5 weeks before he died, and I gave him CPR until the police and the medics came, and I brought him back. But when the police came, I asked them if they had the Narcan, and they didn't have it with them. And I myself was kind of upset about that, and thankfully my son was revived, by the time the medics came. But they did have to administer CPR again in the ambulance on the way. Now my son was let out from the hospital that same day, and that was the end of it. And he continued on the same path. And he finally decided he was not going to get to the end of the line. He worked, and he drove. He was an LPN, he helped others. And he decided that he wasn't going to get to rock bottom. So he decided that he was going to end it himself. And so he overdosed, I believe intentionally, on alcohol, sleeping pills, and heroin, so that he could not continue to hurt his family and himself, because he found no way out. And we didn't know a way out. He was over 18. We forced him to do something, and a wasted life that could have done many things, and we didn't know what to do. And so don't let them hit rock bottom. Because some won't.
Thank you. Will somebody from the panel want to introduce? Okay, Danielle, there's a woman in the back that has a question.
I want to say thank you for letting me know that there are things and programs that you can get into to find out about this. I have a grandson in jail right now, and he was put in for drugs, but I'm not sure exactly if it was heroin or not. But I go to see him every single week, and I sit there and talk to him, and I tell him, he'll be getting out soon. I don't want you on these drugs. He's young yet. He's not 21, and I just want the best for him, and I don't want to see him dead. But he told me that there is no help down there at the jail for him. He's just in the jail, and in the jail is where there is a lot of drugs. He tells me, Grandma, there are drugs in there, and that they're not all coming from the people that are on work release. They're going in with some guards, and I heard that for a fact too. And I just don't understand why a jail with locked on people in it cameras. This is a jail. Why can't this be caught? Why is this going in there to get them back on it before they even get back out in the streets? It doesn't give these young people a chance to even try to get off things. And he would take help if he could. I just think they need help at the jail too. Thank you.
Thank you for that. I just want to let you know there is help at the jail. There's groups that run inside the jail if someone is willing to do that. We run a male and female prison group. It's run by PCS. The other thing that we've done recently with the jail was your son or grandson, was he put in by probation, or how do you get, so he had a probation violation?
Probation.
Was it a hot urine? What was it?
Yes.
Okay, so he's on probation, he has a hot urine, they put him in jail. Okay, we just recently started a program, it's called the MA Jail Pilot Program. And what that is in those cases, if he talks to his probation officer and really truly wants help for drug and alcohol treatment, and his probation officer agrees to it, my office will go down, we'll evaluate him, and if he's in need of inpatient treatment, we'll get him out of the prison and take him to treatment. So there are opportunities down there, but they need to be taken advantage of as well. Speak to me now? I mean, sure.
He tried to get help then. He asked for help, and they said that when he's released, the judge said he could go to this program that they have, but he has no insurance and he can't afford.
Right, and that's the people that we fund. The people that can't pay out of pocket, don't have insurance, they're county funded eligible, they would be funded by our office. And I'm telling you here right now, if he contacts his probation officer, contacts the counselor at the prison, and says that he's interested in treatment, we'll go down and assess him. And if he's appropriate for inpatient treatment, to date we've done 36 inmates, and 20 of them got out for inpatient treatment, and 9 of them got out for outpatient, and 1 we determined didn't need treatment at all. But again, if it's appropriate, we'll do what we need to do. But again, he has to come our way. He has to come towards us. I don't know his name. I can't do anything with him until I know who it is. And so that's what we have going down at the prison. Those 2 things at the present time.
Thank you all for your patience. We do see your hands up, and we kind of have an order here.
Hi, my name is Vicki Beck. I'm a nurse. I've been a nurse at the correctional facility, White Deer Run, and I'm currently working with a local provider. Some news that I can bring to you, and perhaps the doctor to the Good Samaritan Health System. Well, first of all, let me say that I'm surprised that the coroner is not here, Jeffrey Yoakum, because I think he would be an asset as far as, giving questions to him and having him educate us as a whole as to where we can go and get help. I recently learned yesterday, after maybe 4 or 5 hours of research, a patient came in and wanted Narcan for their child. Child was our patient. So immediately we think to ourselves, hey, you're not our patient. We can help you. But let me check into this. So after maybe 4 hours of conference calls, we learned, and after doing some legal research, that the mother or father of their dependent child living with them does have access to the Narcan. You can get it. You need a prescription for it. We found a local pharmacy that is going to send out for it. It is an out-of-pocket expense. It's $500. That's a lot of money. But guess what? For the price of saving somebody, payments, you do what you can, because as far as this heroin epidemic, we are actually going through the grieving process before we lose them. We are in denial. We're angry. We want to blame our spouse. We're going to blame somebody. We want to blame ourselves as parents. So it is available. It's available as an injectable and a nasal. So some people are concerned, do I know how to give it? Do I have to be a medical professional to administer it? I would imagine that they're getting education before they dispense the Narcan to a parent. First of all, you're going to want to call 911, of course, to make sure you have the medical personnel on their way, and you administer it. The nasal, put it in their nose, squeeze it. I think that's our first step, to educate the parents as to what they can do, because they're just at wit's end. They're grasping, how can we help our kids? How can we help? And I can honestly say, as a healthcare professional, my first instinct was to say, hey, sorry, can't help you. We're not our patient. But because it's something that I embrace, working, in the correctional facility, working at New Perspectives White Deer Run, you want to do everything you can do to help somebody and give them the tools. And these kids are going to have to want to help themselves. I know as a parent, when I found my son into drugs, who stole money, actually enough to make it a felony charge, when I found out it was him and reporting it as burglary, I went to the police chief and said, what do I do? He said, how can I help? I said, how do I stop it? I know he's doing drugs. Well, you know, he has a college education in front of him. He's a gifted child. I said, put him in jail. That was the hardest thing I ever had to do. To this day, he hates me. But you know what? Dean's Fellowship, probation department worked with him, DA's office worked with him. He's in society now. I mean, he went to groups. He had to want it. At first, he wasn't caring about it, but that was his first time away from our family, of Thanksgiving, and he had to learn through that court-ordered boot camp that Judge Charles sent him to. When I stood behind him, I was just going like, he's lying to you. You know, they're going to lie, they're going to cheat, they're going to steal, they'll steal your furniture, they will do anything to get the drug. He went to that boot camp, and then he learned. He really learned from it, and he said, you know what, Mom, on that Discovery Channel, what you see, that's not really what boot camp is really about. It is one tough program. So I have to say that he benefited from that. But these kids knew, you know, there's groups available, how to write perspectives, new perspectives right here on. There's groups. Go to them. Go to Al-Anon. You know, reach out to probation. Reach out to those people that have faced addiction, who have lost, you know, people that they love. Because as a group, together we can conquer it. I'm sure.
Just been in jail, and he was in under the, he admitted to his probation to use, and they put him in. But I go to the family's joint, and I asked my counselor if he would talk to him down there. He wasn't allowed to, because he wasn't charged with anything. So he sat in jail for 40 days with nothing to do, nobody to talk to. He's now in rehab. But that just really, really bothered me, that he could not talk to people.
I happen to volunteer at the jail. I'm in recovery, long-term recovery for many years myself. And I'm able to go in and I do 12-step groups with some of the inmates, men and women. And I also help conduct AA meetings. And honestly, it breaks my heart because we go in on Monday mornings and sometimes there are only 2 or 3 women that show up. And the men on Tuesday evenings have AA meetings and sometimes there are only a handful of men. You know, so it's such a complex problem, you know. I compliment you for trying to at least sit down with us and do this. It's overwhelming. And where do you start? You know, for me, I plug in every day and I say, I'm going to help somebody in recovery today. And the inmates, they're thirsty. They're really thirsty, but sometimes they don't understand. It's just the simple thing of coming to a meeting and trying to learn maybe some kind of problem solving, coping skills. You know, I think everybody really tries, and this community, and the people, and I see prisoners every day, and honestly, they're like my boys and girls. I just love them. But you know, you think, what can we do to get in their mind that we want to help them and that there is a solution, you know, and it's a simple solution, but that's the problem. You know, sometimes you have to have the money behind the solution to get the treatment. That's all I have.
Thank you. I want to pause you right here for a second. Up on the screen, there are 2 URLs, and those are both surveys that we put together through SurveyMonkey that have to do with heroin. One is a very short quiz about how much you do or don't know about heroin as a drug, and the second one is a quiz kind of on your perspective in the community and how you may have been affected. It's kind of a quick survey. So if you get a second and you want to go to either one of those with your smartphone,
we'd appreciate the feedback.
Keep ignoring this man here and has his hand up for Bryan Smith.
Hi, my name is Joe Duke, and I just want to say a couple of things. One, I go to Families Joy. Two, I'm a long-time 12-stepper and recovering person. The things that I'm hearing, first of all, I want to say that I had a family member in the county jail. That family member was denied their medication for their emotional health that they're supposed to be getting in there. That family member was denied going to meetings. If it was 9 o'clock and you were walking out that door, the guy would look at it and say, 9 o'clock, you missed it, and it ain't going to do you any good anyway. At $9 an hour, and without proper training, we're not going to get people to represent the people in there. The second thing is that he had that medication because whether it's heroin or any drug, it's a symptom. The drug is a symptom of emotional, physical, and spiritual issues. And those need to be treated. And treating somebody like it ain't going to do you any good anywhere. And I've been in that prison, and I've had guards tell me that the guards bring in drugs. The guards have told me, right in the main lobby at the main desk, when I've had confidential discussions with them. And if we're putting people into prison, I'm not saying this is Lebanon, this is widespread. We're putting people in there, incarcerating them, and then hiring people for $9 an hour so they can make some extra pocket money by selling something to the people that are in there. That's not a good way to do this. There should be a way where, you have dogs that can come in and tell whether people have things on them. Every person that goes in there to work or comes back from work release should have a drug dog or something check them out before they go through that door. Okay, you've got to stop the flow of drugs into the prison, and we have to stop the flow of drugs in our society, not incarcerate the people that have the emotional, spiritual, and physical issues, and then just let them rot. And I'm in Families Joy, and you can say all you want about all the help's available and calling the counselor. And when I had this person in there and I had to work with it, I had to go to the county commissioner several times to get any action taken. It's a neglected system. You can go to other systems where they have, phases. Is there an area where the people that want to work on the 12 steps can go? Is there an area that people want to get their GDE can go? Or do we just throw everybody into a room and say no? But I think what we have to do to be positive is say we have to stop the flow of drugs, and we have to find a way to help the people that have the emotional, physical, and spiritual issues. And I'm willing to do whatever I can, and I also went to the Tuesday night meetings for a while there in the prison. And again, it's not encouraged in there. And, people need to be broken up. If somebody's in there with a person, and in there because they overdosed on heroin, they've been convicted of having heroin or pot or anything else, they need somebody to say, there's a place that you can go, we can talk about this, because they need to be educated. Not just on the drug. You can stop taking, just taking the drug away means nothing. You have to fix the whole person. Thank you, that's all I have to say.
I just want to comment real quickly on the drugs in prison status. First of all, I certainly won't speak to the warden. The warden runs the jail. I did not do that, obviously. And in terms of investigations of any crimes that would occur down in jail, even though it resides in South Lebanon Township, the state police actually do investigations down there. One of the things I need to say that nobody ever wants to hear, but it's just the truth of investigations, is we can't talk about investigations. And I know you all can understand why that is without having to get into it. But I can assure you of a couple of things. One, I can assure you that when there are allegations from inmates of drugs being brought into prison, that it is investigated. All right, I can assure you of that. I can also tell you that investigations down there are made difficult by virtue of the fact that the people that would need to provide the information and be willing to testify are the inmates themselves who, for valid reasons, are afraid to say anything to us. Okay? So we can hear rumors, we can hear stories, we can hear from third parties that there are problems down there, but that doesn't help you to prosecute a case. Now that being said, there are things that I know the warden is doing, that I know the state police are doing. I'm not naive to think we're going to solve all problems with what we're doing. But if there is information, whether it comes from people that you know in the jail, whether it comes from you, whether it comes from whatever source, please provide that to our office. We have a drug task force in our office. The state police, I know would take the information. I can guarantee you that we would welcome that from whoever. I don't want drugs down in jail any more than I want it down the street, any more than anywhere else. So we all agree on that. We need to get specific information from whoever it is that has that. So that's kind of where we're at with that topic. I just wanted to at least share what I can with you about that.
Thank you.
Good evening. My name is Steve Buckley. I'm also in recovery. I spend a lot of time going out to White Deer Run, up to the VA, stuff like that, holding meetings, and spreading the word on, what it is to be sober, what it is, the benefits, having your children come to you, being able to look people in the eye, the basics, reaching out and embracing them. 3 times a week I go to White Deer Run and hold meetings. They tried to cancel meetings there. We fought to be able to have meetings there. I was there last night. I see them from the day they come in till the 30 days they get ready to leave. Now I'm relatively new in this program, but I stick with it because it keeps me sober. I went through 2 detoxes in a 3-week period. I went through your hospital, met with a wonderful man named Tom who tried to get me a bed. Could not do it. Then I went to the VA because I'm a vet. Same thing. Tom actually came out in his own time and helped me get into the VA. Got into the VA, same thing. Could not get me a bed. They treated me and streeted me. I took a cab ride straight from the VA, straight down to the welfare office where your people helped me out. A nice little Spanish woman who was not taking no for an answer. Being able to educate how to get help for your children. So find people like this don't have to sit in rooms like this. We shouldn't be sitting here at all. What I'm trying to say is treatment from the beginning to the end. Once they get to the end, don't just put them out on the street. I am living in a recovery house now. I got a $600 scholarship to help pay for me to be able to stay there. I now have a job. I'm a productive member of society. I've cleaned up all my wreckage. I've cleaned up all my charges. I don't have to be afraid of people with a badge anymore. Because of follow-through, because of education, because of AA and NA. I go 3 times a week and hold these meetings because that's where I keep myself sober. That's how I stay productive. That's how I make it work for this alcohol. But we need to have better follow-up. Not just put them out on the street, you're not drunk anymore. There, we brought your levels down. They held me for 4 days because my alcohol level was so high. When my alcohol level was low enough, the whole time, this wonderful man Tom was calling around, trying to get a bed. I did it on my own, through sheer willpower. We need to have better services of steering, helping these doctors, helping these medics, helping the DA, helping the gentleman that is up there trying to get the money. Pull together. Communication. When these people leave, it's like White Deer Run. Some of them just leave and go back to the same exact environment they were in. That is not what I did. I thought. I worked with my counselor. I asked questions. I tried everything I could do every day to make sure when I hit my knees in the morning and ask God to keep me sober, and at night when I ask God or thank God for keeping me sober, and everything in between, I had help. I was steered in the right direction. There are programs, but finding them for some of these people is just impossible. And when people leave White Deer Run or any of these other places, they don't know where to go. Some of them just walk out the door. Some of them were even picked up by their spouses, boyfriends, girlfriends, the same exact environment. You're just wasting your money. You're spending 30 days getting sober to go back to the same exact thing. I kept in touch with, I'll call it the class of people that I was in with. To this day, I can't get a hold of any of them. Now I'm staying in touch with the people that are getting out of White Deer Run now. And trying to help them, saying, look, there is programs out there. Last night, girl said, I'm leaving Friday. I'm scared to death. I don't know what to do. Go down to your local welfare office. Go down to your local church. But we only can do so much. We need to have, like you have this facility, the Renaissance. There should be a drop-in center there when you get out. The day you get out, that should be one of their first stops. Stop in. What is your problem? Because they can either go left to their dealer or they can go right to us, to these people. It sounds like that gentleman, myself, this lady, all of us would gladly staff these things a couple hours a day, steering these people after treatment, steering these people after the hospital, steering these people, the vets, when they get out, the PTSD, everything that goes along with it. He's right, you got to treat everything. You just can't take the needle out of their arm or the bottle out of their hand and just say good luck, because there's no luck involved. It's a long-term progressive disease that will kill you, and if we had cancer, everybody would do everything in their possible way to treat us. It's almost brushed aside. I'm not saying it's on purpose, and I'm not saying we're not doing enough, but we're not doing enough. And there's a lot of simple solutions that don't cost that much money. I'm the product of it. I've been sober since May. Since May, I have my child looking me in the eye. I have a job. I'm able to help people. I'm able to do things. I go to bed, I get up. I don't pass out and crawl out of bed anymore. But I changed through other people's help. And it was free help. Most of it was free help. I work with people at Career Links. I work with the Step in the Life program. I work with White Deer Run. But the only reason I do it is to educate for the next guy that comes out. So now when I go into White Deer Run, I say, all right, you're getting out Friday, you know where to go? Talk to this person. Share information with other counties. If Lebanon County can't do it, maybe Lancaster County can. There's scholarships for people that come out that don't have any money. These places are not free. Recovery houses are not free. I see it every day. But there is, if you give them a base, if you give them something solid to stand on, they will grow with that program. If you give them a small hand up, I think it's a lot cheaper to give treatment and help and follow-up than it is to house somebody in jail every day. And I believe it's a hell of a lot more productive. And I think that's something we should be thinking about afterwards. You gentlemen sit up there, how many people have you seen 4, 5, 6, 7 times over and over? Bring a bunch of parole officers in here. Half of them didn't have gray hair when they started the job, and they're just throwing their hands up saying, I'm going to stick you back in jail. Education, treatment, and follow-up. That is, I think, one of the things that is going to help save this county, save our young ones, and keep parents, brothers, sisters, uncles, aunts. I know of like 7 or 8 people that have died since I got out in May. One of them I went to rehab with. Just left and died. Follow-up and treatment and all, ask us. We are here. We might be anonymous, but we all know each other. Having a staffing at the Renaissance, a couple hours a day, steer them our way when they get out. Like you hand out a card for someone that, God forbid, is getting abused. When you're leaving, here, this is another program. Go meet with this guy. We help each other every day. It's an anonymous, free program, but you have to want it. We want it, and our biggest thing with that program is to share and give back. That's all I have. Thank you.
clinic in Lebanon, why we don't have methadone treatment in Lebanon County Jail. And I would like an answer to that question on the basis of, would it not be better to help people? I hear you saying this, I hear people all over the place saying, the way that we're doing treatment, the 28-day program, it doesn't work. People, they go back to the drugs, they go back to the alcohol. Well, it doesn't work because it doesn't work. So can we help people with medication? What about the people that are on methadone that end up going to jail? What happens to them? I mean, I know we have a nurse here. I would love to hear from her. What happens to those people? They have to detox in jail. Is that done safely? I would love to see the warden here. He could answer these questions for us.
Can I just answer part of that? Part of that is we do have a methadone clinic in Lebanon County, and our office funds 65 individuals for treatment, and that is the limit that we put on. That's the number we put on. And right now we have 46 funded clients. So again, we're not, I mean, we have 21 spots. So I don't know why more people aren't seeking that funding.
With all due respect, are they allowed to have methadone in prison?
I'm talking about people that are walking the street.
But I'm talking about
I can't speak on prison policy. That would be a board question. But I know if they do go to, if we have them funded on methadone and they go to prison, they're on a 21-day team. I can tell you that, yes.
21 days.
And they're not getting methadone after 21 days.
But they have to do a program in order to do that, is that correct?
I'm not aware of that. I know what it is with our program.
Okay, so if they're on your program, you're taking them off for 21 days. How about somebody coming in off the street? They have a probation violation, they're thrown in jail this afternoon. They're on methadone. Somebody answer?
Were you asking a question about the emergency department or the hospital?
No, I'm asking about the prison. This is scary.
With all due respect, though, I mean, I can't speak for the warden. I can't tell you what
Well,
his
somebody
policy is.
here knows about how the prison is run.
Well, I just said, if we fund someone, they go to prison, we
Yes,
will fund
I
them
heard
for
you.
another
Yes.
21 days. If someone comes from the street and is on methadone, I can't speak. I don't know what their policy is.
Right, thank you.
I don't either. I know that they have a program that they use down there for withdrawal. I actually don't.
What is that program?
I don't know the answer, ma'am. I'm sorry, I don't, but I don't, again, I'm not like a witness, so I don't know the
Do
answer.
you find?
We simply put together for emergency response.
Does anybody? Yes.
I might be able to help you. My son, is a heroin addict, and he went through the methadone clinic in Lebanon, and he decided he didn't need it, so he quit. And they decided, well, they didn't need it, so he was buying it off the streets. And he got stopped, and because he had methadone as a prescription, he wasn't his first time.
You what?
Wasn't his first time to get into trouble. He was put in jail, so he just, you know,
Withdrew from the
withdrew, yeah.
Is that safe?
It's uncomfortable.
No, it's uncomfortable. Okay. All right, but is it safe?
If a person is healthy, otherwise, a heroin
Are you
withdrawal.
healthy though when you're on heroin?
Well, there's a lot of ways to answer that. Does a person have hepatitis, HIV, how malnourished are they? But in general, heroin withdrawal is not going to kill you. It's just going to make you miserable.
But how about the things that happen as a result of heroin withdrawal?
So the vomiting, the diarrhea.
Dehydration. Are we doing anything in jail to help with that? Giving extra drinks? How do we? I'm just
No,
asking.
that's a good question.
Ma'am, I understand what you're asking, and in part I take responsibility for not specifically asking the warden to be on this panel. This is our first endeavor in something like this, but it is something that we plan to follow up on. And by we, I mean, the staff at Lebanon Daily News, in terms of asking these questions of the warden and trying to get answers and make those available to the public. That's our commitment as part of what's going on here tonight.
Can I just add that if a person comes to the hospital looking for help, we will do our best to help. engage in crisis services. People who want help, about half of them get successful placement from the ER. People that come by ambulance as an overdose, we don't have much success. They generally, as has been said, they have to be looking for help. But we do our best, and we treat withdrawal symptoms, not with opiates. We can effectively treat withdrawal symptoms. I mean, if you need help, and we can help, please come to the hospital.
Well, one of the things I don't mean to put you under any type of microscope, I think it's awesome that they're here. And I appreciate it. Thank you very much to all of you. But I think it is a question that people have in Lebanon County. And I may be the only one that's willing to stand up here and say it. There's a gray elephant in the room, but, I'm asking the question. And not because I want to put you on the spot, but because I have a personal care and interest in knowing the answer. Thank you.
Thank you for that, and that's exactly why we're here tonight, is to ask questions. And if we don't have answers, we'll ask the people that we hope to have the answers.
Thank you.
Hi, my name is Kimberly Ernst. I'm from Pennsylvania Counseling Services Renaissance, and the gentleman over there mentioned the need for a drop-in center in this county, and PCS looking to do something like that. I just wanted to say that that is exactly what we're currently working on. We have construction currently underway for a project that we were lucky enough to work with Jim's program to get a little bit of funding to have a recovery center available at 701 Chestnut Street. So it's right there, it's right around the corner from our current building, if you all know where that's located. They currently have 2 meetings right now. The back half is still under construction, we're still in the process of building things. But they have an AA meeting on Tuesday mornings at 10 o'clock. And then they have a 12-step big book study Wednesday evenings at 6:45. So that's currently up and running, and we also actually have our first employee for the Recovery Center who will be working part-time, Aisha. She's going to help try to get people connected with services, and our goal is to eventually be able to staff it full-time or as full-time as we can with the funding that we have, to have people there that if you need services and you don't know where to go, you can drop in, and there's someone there that can help you fill out medical assistance applications, that can help you call around until you can find a bed, that can help you get food stamps if that's what you're looking for. All that kind of good stuff to try to get people connected up to the resources that they don't always know where they are. So I agree with you. We at PA Counseling agree with you. And we are in the process of making that active. And our goal is by October of this year. So we're hoping in the next month to be able to open our doors at least part-time. And then hopefully more fully as things take off. We're working with the Recovery Social Club. Not sure if anybody's familiar with that program. They were around years and years ago, and they're sort of making a comeback. And we're working in conjunction with them to try to get services up and running.
I do see all the hands. I have to make my way around.
While you're walking, can I just keep walking? It's all good. One of the things, there's maybe an unspoken tie that we see folks that are maybe involved in illegal drug activity that it rolls into. We also see in the psychiatric behavior piece. And as Jim was talking earlier about the growth of this problem in our community, and as I hear we've got construction, we're working on this. The infrastructure in our community is absolutely one of the things that's lacking. And to support that, our most recent endeavor is that we've been transporting psychiatric patients to Clarendon. So to put that in perspective on how lacking of resources, and it's, I don't know that there's any specific place to place any blame on it. I think just in general, when we look at that growth, this is unexpected growth that is almost become unmanageable. It probably is unmanageable for most of us. I can tell you from just the response volume for our organization, we're going to crest 28,000 responses in the Lebanon community in a fiscal year. So our community is experiencing growth that we've never experienced before, and hopefully things like this will bring the recognition and some of the funding to support the physical infrastructure, the personnel infrastructure, places for volunteers to be there as a support. But I think there's going to be some. We're just behind the 8 ball right now.
My name is Christy, and I am a grateful recovering addict. And on October 3rd, 14 years ago, I walked in Renaissance Crossroads, which saved my life. It changed my life around. I am a productive member of society. I have my kids back in my life, and I'm doing good. There's, some areas that I still slack in, but I do work for the methadone clinic, which I have seen it work for people, and I've seen some people that don't want it and they're abusing it. The people that want it and take advantage of the services, the counseling, the individuals, the groups, they're being there every day for their dose, and eventually the goal is to try and taper off of them. And we do, if any of the clients get incarcerated while they are ours, we do taper them off while they're in jail. The jail does bring them to our clinic, and we dose them there. I had a recent experience, my neighbor, who I wasn't real close to, but I never knew she was a heroin addict. On July the 4th, she overdosed, and her daughter found her. And it was the most traumatic thing that I personally have gone through, especially being in recovery. I mean, I've seen things, I've had guns in my head, I went through all that drama, but to actually see them taking her out on the gurney, and a couple days later, she came back home. Well, her truck was always there, so I thought that she was home. But then we're talking to her daughter because I became closer to her daughter and told her, if you need help, you can always knock on my door. I'm there for the next recovery or want to recover person. I don't know, maybe a month now ago, there was like this odor coming out, through the building, and it smelled like cat litter. Well, it kept getting stronger and stronger, so somebody that was close to the daughter had called the state police. They came out and they found her dead. She was there almost a week, and I never knew she was home because the last that I heard, she had went to a long-term rehab or a short-term rehab in California somewhere, and I never knew she was there. And this epidemic of heroin, and people can die from alcoholism. They just stop. It breaks my heart, and I want to do the next thing that I can do by being in NA and taking NA meetings to the prison, which I try and do on a regular. I'm involved, in service work for NA, and the things that I do in my life, I love the peace and the serenity that I have now, and that's what helps me. And I just wish I could help everyone. It breaks my heart when I hear these tragedies, and especially people that I've known. As this year alone, I've known 4 people that had overdosed and died. And
Thank you.
My name's Donna, and I'm new to this. I only found out a week and a half ago that I had a heroin addict for a grandson. And so I cry a lot. I'm scared to death. But anyway, when I first found out, I went right away to the merchandiser because under their community calendar, they always have places to go for grief or for AA or whatever. They always had a list. Well, it wasn't there that last week or this week. It wasn't there. So maybe the Lebanon Daily News can do that because people know where to go. I don't know where to go. So I look for that information. That's all.
I was wondering if someone on the panel about the treatment options available in Lebanon County, either short-term, long-term rehab?
Sure. We already spoke about the methadone. So we fund for methadone through our office. We also fund for detox. If someone needs to be detoxed before they go to treatment. And we fund for short-term rehab, which would be 14 days. And we also, long-term would be 28 days. We also are now going to be involved with PCS, Renaissance Crossroads. They have a program which is 12 months. And the people that are in that 12-month program are court-ordered through the district attorney's office and the courts. But they're also going to start a 4-month program. And those individuals do not need to be court-ordered. Those individuals can go into that program. It could be court-ordered, but it doesn't have to be. And that's something that our office entered into a contract with PCS. If someone comes to our office needing that care and can't afford it, don't have insurance, we would make funding available to that. We also have funding for halfway houses. We have funding for partial hospitalization. We have funding for IOP, which is intensive outpatient counseling, which is three days a week. We have funding for regular outpatient, which is 1 day a week. So there's a variety or a continuum of services that we can provide depending on the assessment, the level of care assessment where that person should be. And all that information I have with me. Mr. Count has our brochure. It lists all our numbers, all our contact information, and it'll tell you the services that we provide.
At this time, we are getting closer to 8 o'clock, so those that do have comments, can I please see your hands right now so I can get an idea of where you are? And after that, we'll close it off.
My name's Debbie. I just have a concern. I know this is about, people who are, have family members that are addicted, but my concern is the drug problem really getting taken care of, that you're trying to get the dealers off the street?
I guess the answer is yes, we're certainly trying. Understanding simple economics, though, I think it's naive to think that we can prosecute our way out of this problem, particularly on a local level. We have a drug task force in the county that's assigned full-time to drug investigations. That's what they do. But we can multiply that task force by 100, and we still wouldn't solve the problem of prosecution. So I think we try very hard. I think our officers work very hard in Lebanon County to work on these cases. We get assistance again from the state police, from the DEA. There was a substantial drug arrest a couple of days ago. The arrest was actually in Lancaster, but the people were from Lebanon. So we do work on it from that end. But it's what brings me here to sit with this panel is that I know that prosecution is not going to by itself solve any problem. It's going to take a collective effort, and that's why I appreciate everybody being here to talk about it and bring ideas together. And we'll continue to try to do our portion of this, but again, it's going to take all of us to solve that, not just police officers.
Hi, my name is Jamie, and I have something going back to the funding. What happens when funding's not available? Like when funding runs out?
Well, like with any funding stream, last year it ran out, but we went over. So it runs out. We're not an endless pit. It's going to run out at some point in time. Last year we were over in certain categories, like detox was one of our biggest services that we funded, as well as rehab, because of the heroin epidemic. and as well methadone. And then there's other areas that we didn't spend as much money. So it's kind of like a balancing act. But there is a point where it's a breaking point where you only have so much money. You can only provide what you can provide with the money you have. At some point, the money runs out, and then we wouldn't be able to fund people at that point. How do we what? I don't. That's a good question. I don't know how to answer that, to be honest with you. I mean, NAA is free. I know that for sure. There's other things in the community that are free that people can access. I would hope that someone with private pay, insurance pay, or county funding would hold up that we could treat people. That's not always the case.
For the methadone and the Suboxone clinics and things to get on that medications, client has to come in, either obtain it illegally or come in with like dirty urine just to get into the program. Now, if they're clean for a certain amount of time, why would they want them to relapse just to get one? Like
What program are you talking about?
Mostly
I mean,
the Suboxone
specifically,
clinic.
Suboxone?
I know they don't have it in Lebanon right now, which is methadone.
Well, we contract, our office contracts through the RAISE project, and the RAISE project, we do fund people for Suboxone. I can't tell you what they tell you, there are requirements for you to even get on it, but, if they set requirements and you pass their requirements, we'll fund you. Okay, but I can't answer for the RAISE project and what conditions they put on you. I can't say they told you that or they didn't tell you that. That'd be something that they'd have to answer. I can't answer the question. That's out of my knowledge.
I had twin daughters in 2013 that I had no idea were heroin addicts. They had college degrees, they were living together in an apartment, and we had to do a family intervention. Unfortunately, Brooke lost her battle February 24th of this year, and they were heroin addicts. It's been a struggle. I was not knowledgeable at all about heroin. I educated myself, I read things, I watched things, I cried, I sobbed, I grieved. My goal was, Brooke did not want to die, she just wanted to feel better. Addicts do not want to be addicts, believe me. They hate it, they're just addicts. They need mental health, physical health. It's a process they'll have to deal with the rest of their lives. We've held 2 vigils in Brooke's memory. I have been on Channel 8 News, Channel 27, Fox 43, York Daily Record, all kinds of articles. I am raising awareness, and that's how I grieve for my daughter. I'm trying to make a positive thing out of a negative thing. Her sister is right now in recovery in Lebanon County. She's sober at the moment. She did relapse, but she did not deal with her identical twin sister's death. She needs grief counseling, a lot of it, because she does not get grieved over her sister. She did get the resources. She started IOP. She went, checked out the methadone clinic. She's doing things she needs to do. I strongly encourage everybody to learn everything we can about addiction, about heroin. We have to stop stigmatizing addicts as well. That's why a lot of our kids are not seeking help, because it's a stigma behind an addict. That's one problem. I also feel jail is not the answer. I feel they get dry in jail, but not sober. Now, my daughter, Alyssa, was in jail, but she got court-ordered 90 days to Eagleville, and that was the best thing for her. And I feel 30 days is not long enough for a heroin addict, because their whole total mechanism in their brain totally changes with heroin. It takes years, not just months. So I'm a firm believer in treatment. There is things out there, but an addict has to want help. We can't help them, we can't enable them. They have to want the help. If anybody has questions or wants to talk to me afterwards, but I am raising awareness. I went to the district attorney in Adams County, where I live now, and I started the ball rolling because I said we need a heroin task force in our little county. Because I said it is here, it's going under the radar, but it's there because a lot of people have reached out to me on Facebook because I put all kinds of heroin awareness things. I'm not ashamed that my daughters are heroin addicts. I am trying to help. If I can help one person and save one life, and I believe I already have, and it's in my daughter Brooke's memory, because everyone that was in recovery with her reached out to me and said she was so instrumental in my recovery. She helped me so much. She saved my life. And she worried about everybody else and helping everybody else, but she had a very big heart and she didn't concentrate on herself. Fortunately, there is a law. The girl that my daughter was with that's admitted to supplying her the heroin is incarcerated, and she has been charged with delivery resulting in death. And that's like a second-degree murder charge. So they are doing things. I heard Lebanon County's thinking of forming a heroin task force. Do it as soon as you possibly can. Your task force, I've been to a few meetings, they are making great strides. And as far as naloxone or the Narcan, I was told family members that have addicts can go get a prescription, but I lived 10 minutes from Evansburg, Maryland, and I was able to go take a training. A doctor was there, and I got 2 doses of naloxone for free. So we need to work on that to make it affordable or free or whatever we can do. But it is available for family members because I have it. I took the training and I have it. And the nose spray is very easy to administer. But I carry it in my car because you never know. You see somebody slumped over in the wheel in a parking lot and has overdosed, or anywhere else that you can save a life. It's in my car, in my glove compartment. So, you know, educate yourself, raise awareness, don't stigmatize the addict. And there are resources out there, and it's going to take a long time. It's going to take years to get things in place because it's an epidemic. Every 3 minutes, somebody in our country is dying of an overdose. Thank you.
Excuse me. Real quick, I just want to address one thing you brought up. We are in Lebanon County forming a task force. We actually have our first meeting tomorrow morning. My office, along with Mayor Capella's office, are going to co-chair this task force. It's our first meeting tomorrow, so we're aware that that will be a big help. So, thank you.
Hi, my name is Heather Parks, and I work for the RAISE Project. We have offices in several different counties, including Dauphin County, Lancaster County, York Adams, Perry, Cumberland, and also Lebanon County. Now we have different programs in our office, and I didn't really hear the Suboxone mentioned a whole lot here today, but we have a buprenorphine coordinator program, and that is similar to methadone, but not the same. But it is also for heroin addicts, and to help them with withdrawal, and it's also like for maintenance. And we also have a program called the Recovery Specialist Program. That's the program I work for, and I'm a certified recovery specialist. And a lot of people mention sort of connecting people with people as soon as they got out of prison or out of treatment. That's what our program does. So I'm just letting you know, the RAISE Project, we are out there. Our services for the Recovery Specialist Program don't cost anything. So we're an additional resource for the addicts.
My name is Tom Shank. I'm sorry I'm a little late. I believe that we need to listen to our children. We can preach and preach and preach, I'm a bit of an expert on heroin, and I've never even seen it. But if you listen to your youth, they'll say, Jane just died and Betty's next. I called the police department, tried to identify somebody that's at risk, and I'm a pretty smart guy, and I'm having a little trouble navigating, finding who can help these people that are at risk. I agree for the people that have already died. But we can't do anything about that. When we do, we are able to identify those that are at risk. It's more available than you might think. And that's what's shocking. I guess they'll even help food. That's all that's available. They experiment. If we lie to them about drugs, we need to talk with them, not preach. Please listen to them. Because I think they're crying out. They know what's going on. They know who's going to die next. It's shocking to me. But I think, again, just to emphasize, let's not preach to our children. Let's listen to what they have to say. They'll help us. Thank you.
Hi, my name's Arelis. I keep hearing everyone saying a heroin epidemic, but what I believe is what is going on is an addiction epidemic, because like you said, it is not, if they cannot find heroin, they will find another drug to use. We need to work on an organization where they have mentor programs. I know there was one in Allentown for human trafficking, and when they took the women off the street, they had a program built where they had a one-on-one mentor, just kind of like a youth advocate program. And maybe that's something that we can look into. I don't know if that's what the RAISE project does, but if it is, that's great. We really need to work on a character building program, because it comes from a lack of character, a lack of discipline. If we instill these morals and beliefs into them, I think they will be able to change their ways.
Hi, my name is Charlie. I have a 35-year-old heroin addict for a son. He's been that way for half his life. I've experienced everything that these people talk about. Nobody mentioned the C word. It's going to upset some people, but there's a choice factor involved. And I say that for this reason. Listen to the recovering people who had different addictions, and they talk about how hard it was to find the services. But they found them because they wanted to. Everybody is talking about all the services that we need and how we have to help them in all the different aspects of their life. But until that addict decides that he wants it, there's nothing we can do. And it's a killer. There's an old expression that you cannot lead you can lead a horse to water, but you can't make him drink. The response to that is you consult his oats. So what I want to know from the recovering addicts, what made you seek help? How can we salt their oats? Because there's two times for choice. The first choice is when they're young and in their teens and foolish. We have to teach them to make the right choice. I don't know if we scare them in school with horrible, programs and show them what really happens if you can scare it out of them. I don't know. I thought my kid was intelligent. I put him through the Catholic school system. He made that stupid choice. How do you teach them not to make that choice before they're an addict when it's just a choice? Because once they are an addict, now it's an addiction. But they still have a choice. They have to choose to leave the life. And everybody I know who left the life is in somehow working, helping others. And that sounds great. But I want to know about people who have left the life and went on to live a normal life and are not constantly surrounding themselves with it. We want those people helping others. I want to hear success stories. How did you leave the life and how did you create a normal life away from it? How do we salt their oats, folks? I want to know how you get them to make the choice to leave the life.
Thank you very much. We know that this isn't a closed subject, obviously, and we know that we're just touching the surface. But before we close, I would like to ask anyone from our panel if they have any comments in closing. If not, that's fine, but I just want to give you folks the opportunity.
I think it was said here by a couple different people. One big factor is they have to get away. That's my strong feeling. People have an addiction lifestyle, and they surround themselves with opportunities to stay addicted. I think the success of some of these long-term programs has a lot to do with taking them out of that environment. And I think that's key. Just doing something different, you know, different circle, different acquaintances, different life. People come out of rehab and out of addiction back into their old environment, and they don't resist it, not very well. That's my feeling, that's what I see.
Again, thank you all so much on behalf of Lebanon Daily News and our very distinguished and helpful panel. This is an issue that will continue to be addressed, and we hope to keep telling stories of hope and help in any way that we can to be a community, because we're all in this together. There is some information about treatment and help on the table on the side, and there's refreshments in the back, and we thank you so much for coming this evening.